Good evening, Professor. My name is Daniel Chansa in MSN 572 Advanced Physical Assessment course at the University of United States. And I am kneeling because my exam table is low to the ground, so I gotta be on the working level. That's why I'm kneeling. And I have a volunteer female patient here that's gonna help me with my abdominal video. And I need to get consent from you to be able to record this information and also place it on YouTube as unlisted video for my professor to be able to assess my skills of abdominal exam. Is that, am I able to get consent from you?
Yeah.
All right, so first line of business, I would wash my hands. And I have my ruler and my writing utensil in order to measure the liver. Would you be able to lay down flat? And I'm gonna place a pillow under her knees to relax abdominal muscles while we do the exam. And I'm going to cover with a drape to give privacy. And then I would ask the patient to roll up her shirt. And I want to expose the border of the rib cage, and then here it will be right in the pubic symphysis line. And the first line of business as you do the abdominal exam, the first one is to inspect. So I want to inspect the abdomen by looking at the shape, looking at the size, looking at this how symmetric it is, looking at the umbilical area, making sure there's no hernia. Also looking at the skin around for scars, lesions, rashes, pulsations of the aorta, and also looking to see if there's any peristalsis movement. Then the second step is to auscultate. And abdomen is cut cross section in 4 on the mid umbilicus level. So we have the right upper quadrant, left upper quadrant, left lower quadrant, and the right lower quadrant. And I'm going to listen clockwise, beginning with the right upper quadrant. And I'm listening for vowel sounds, listening for the pitch and quality. And normal range is between 5 to 32, and listening for pinkering and tinkering of the vowel sounds. You're listening all 4. And then I also want to listen to aorta, listening to bruits or any turbulence sounds. And the aorta is above the umbilicus, which branches off to renal arteries. Bilateral, you listen to both, listen for the same thing. And then from there, below the umbilicus, you branch off to iliac arteries, and you listen to both. And my stethoscope is a high quality one. It doesn't have bell and diaphragm, so it's just more amplified. So if I had the other one, I'll listen to both diaphragm and the bell. And then from the iliac arteries, you go down below the pubic symphysis line, and that's your femoral arteries. And you listen to both sides bilateral. From here, I'll go to the right upper and listen to the hepatic, see if there's any hepatic friction rubs in the liver there, and there's none. And then you come here by the 10th intercostal space. I listen to the spleen for any splenetic friction rubs, and there's none. All right, and that's your auscultation. And then the next step in the abdomen exam, we're going to do the palpation. And I'll start with one hand and right upper quadrant, and you want to palpate, about 1 centimeter deep, and this will get the patient used to the touch and the temperature of your fingers, excuse my cold hands, left lower quadrant and right lower quadrant. And then the second step, now I want to use my right hand, my left over my right, starting with the right upper quadrant, and I'm palpating deep, 5 to 8 centimeters, and you're trying to feel for any pulsations, any masses, anything irregular as you palpate the abdomen. And then you go down to the left lower quadrant and then right lower quadrant, and it's a normal exam, so there's no abnormal findings. And then I would palpate the liver just to feel the border orbit, and I'm going to use the hook technique where you curl your fingers. I ask patient to take a deep breath, and you hook your fingers and you could feel the liver. And then I come to the left side here, and I'll do the same thing as I take a deep breath. And right 10th intercostal space is the spleen. I should not be able to feel the spleen because that's abnormal finding. You shouldn't be able to feel that. And then I'm going to put some pressure to see if we have any rebound tenderness. So what that is, I'll ask patient if they're feeling pain while I press or after I press. Either are indicative of having some kind of peritoneal inflammation. So you do that, and there's no abnormal findings. And then now I'm going to measure the liver. So I'm gonna measure the liver, then we'll percuss. So as we're percussing, I'm listening for a door sound as I go up, and once I find it, I'm going to mark it, and then I'm gonna go above the intercostal lines here, and I want to go down now. And you want to percuss in between, because in the ribs itself you're going to have a dull sound, and we're looking for a tympanic sound here. Sorry, looking for a dull sound. Okay, and once we find it, now we can measure the 2 points, and it's measuring about 10 centimeters, which is normal. Normal is between 7 and 12 centimeters. Now we're gonna continue percussing, but I'm gonna do in all 4 quadrants at this time. And you start with my right upper quadrant, percussing, and I'm tympany because the abdomen is filled with air. And if I find dull sounds, that present signs of having fluid or masses. And in the bladder section, it should be a tympanic sound as well. That's where the patient empty the bladder before the exam. And it's all tympany. So now we go to the liver. You percuss, and that's a dull sound. And right above right below the liver is a gallbladder. So if there's some kind of infection or cholecystitis, we're going to do the Murphy's test. And how you get the Murphy's sign that's positive is when we put pressure there. The patient asks the patient to take a deep breath. As they take a deep breath and I push down, if there's a cessation of inspiration or breath, it means that there is a positive Murphy's sign, which means it's a positive for cholecystitis. So you want to work up those tests. That's more indicative of the finding. Ask patient to take a deep breath. On up, press down, and it's negative. There's no pain. And then we have McBurney's point, which is in the right lower quadrant. And McBurney's point, to find if it's positive or negative, they also will present pain in the right lower quadrant. But where we place it, it's going to be 2/3 in between umbilicus and the iliac crest. and you put pressure there, and if there's pain, it's also indicative that there's an infection of the appendicitis, so you also want to work up to those findings. Rob's point, I'm going to ask patient to lift her leg up, and I'll put pressure, and if there's pain while we do that, that's indicative of peritoneal infection as well. Latchman's test is another special test. Ask patient to lift her knee up and then flex it, and if she's exhibiting pain in the lower abdomen area, it's another sign that there is infection in the peritoneal cavity. And now I'm going to ask my patient to sit up. And this one we're going to check for the vertebral costal angle tenderness. That's your ribs. Excuse me, that's your kidneys. Any malfunction with the kidneys. So the kidneys hang around here on the 12th intercostal space. That's where the kidneys are. So I'll find it and put my non-dominant hand, then I'll percuss with my dominant hand. And any pain there? There shouldn't be any pain. If there's pain or tenderness, it means that the patient might have some kind of infection or some renal related infection. And that presents the end of the abdominal video. Thank you.